Okay. I will start off by greeting everyone a good afternoon and also thank you and a huge shout out to Lamp Foundation for providing us with quick references and then quick educational tips when it comes to pain. I also would like to thank everyone for their support and carving time out of their busy schedule, especially on a Saturday, to be able to join us and make this presentation meaningful. So, a couple of housekeeping rules. If you have, please keep yourself muted. If you have any questions, you can unmute yourself or you can type your questions in the chat box. I will monitor the chat box moving forward, and I'll also share the references that I have found that would actually help you. So, before we start off, um, I just would like to give a few facts about hip pain, which is our topic for today. So hip pain. So without a fully functional hip bone, you cannot stand, you cannot walk, you cannot run, or you cannot dance. So if the hip becomes painful, certain day-to-day activities really get affected. It becomes troublesome. So it really puts your life on hold. So depending on the condition that's causing your hip pain is manifested through the thighs, the inside or outside of the hip joint, your groin, and even your buttocks. So in a study done in 2020, the most common causes of hip pain is usually osteoarthritis, especially for the elderly. And then you can have bursitis, when the joint between your hip and the femur becomes inflamed. You can have your tendons inflamed. Osteonecrosis, meaning to say there is not enough circulation to your bone, especially on the hip. And most of all is usually muscle strain, hip fracture, and dislocation. So, what about in the Philippines? Now, the World Health Organization was looking at hip pain to be around 10% of the total population. So, based on the Philippine statistics, which is calculated World Health Organization, progress to 2024, there's already 119 million Filipinos. So 10% of that, 11.9 million usually suffers from hip pain. So a study was done, and it's most common among women aged 70 and above, and occurs about 160 women per 1,000 population. I will share this information in the chat box and the references. And without further me blabbering around, I will forward this to our guest presenter, Dr. Hector de la Cruz, for hip pain.
Thank you very much, Dr. Ryan. So let's get down to what we came here for. Okay. We will appreciate it if you ask questions. You write them down on the chat box. So let's get started. Hip pain. I'm a little bit biased on ear acupuncture, so I would like to focus on maybe you would like to know more about how ear acupuncture can help. Okay, let's do a little anatomy here. The hip joint is the largest ball and socket joint that belongs to the synovial joint. And this is most stable and flexible joint in the body. Despite its inherent stability, the hip joint provides the necessary high degree mobility for performing daily activities, such as standing and walking. The area surrounding the hip joint is, as you can see on the slide, is supported by strong joint ligaments and a thick, strong muscle layer. So if you have problems within the hip joint itself, the patient will experience pain on the inside of the hip or the groin. If there is hip pain on the outside of your hip, on the upper thigh or at the outer buttock, this is caused by problems with muscles, ligaments, and tendons that surround the hip joint. If the hip pain is caused by diseases and conditions uh, in the lower back or the knees, so this is what we call referred pain. So that means you already have an accompanying problem, or it started with your low back or your knees. So we are very thankful that somebody suggested the idea of doing knee pain next time. So most hip pain can be controlled with self-care at home. So that's the good news. Hip pain refers to pain that is felt in or around the hip joint, and this can result in functional deterioration. So what do we mean by that? You'll have gait disturbance and limitations in performing the activities of daily living. And take note, in addition, hip pain can cause emotional pain. Okay, what are the causes of hip joint pain? This can include diseases of the hip joint, musculoskeletal system around the hip joint, soft tissue abnormalities, nerve entrapment, and damage. Unlike Western medicine, which attributes pain to localized issues such as inflammation or injury, TCM, or traditional Chinese medicine, considers a broader spectrum of potential internal imbalances. This may include stagnation of qi and blood, invasion by external factors like wind or cold, or underlying deficiencies in vital substances like yin and yang. The hip pain is usually due to invasion of cold and dampness. So we don't need to explain the other causes. We will focus on cold and dampness as causing the hip pain. From a Western medical viewpoint, it may be due to OA or osteoarthritis. So here you can see the difference between a healthy hip joint and OA. In the beginning stages, we will not have a problem because this can be successfully cured. Last stages of OA, acupuncture cannot effect a cure. So, and the pain is usually unilateral or one-sided, and hip pain seldom occurs as an acute episode. It usually develops very gradually over the years. So most of the patients, or all of the patients that will come to you with hip pain, will probably have had it for quite some time already. Osteoarthritis is often caused by degeneration of articular cartilage and secondary bone hyperplasia. So this is something that is inevitable. It can be divided into primary and secondary osteoarthritis. Here, we mainly discuss primary degeneration of articular cartilage. And this is often seen in middle-aged and elderly age groups. And this is also related to heredity and physical fitness. Osteoarthritis is the foremost predominant chronic rheumatic disease, and it is a leading cause of pain and disability in most countries worldwide. In the Philippines, as mentioned by Dr. Ryan, its prevalence is 0.5% in individuals aged 20 years and above. So take note, this can be found in individuals aged 20. And this increases to around 11% in the population aged 60 and above. According to an international database from the US Census Bureau, there are around 10 million Filipinos. So I think my data is quite outdated. And as mentioned by Dr. Ryan, it's now, of course, we're now like 110 million or even more. And there are around 10 million Filipinos with OA, which is expected to double in the next 25 years. Hip osteoarthritis is a major cause of restricted locomotor activity and functional disability. And this may progress to a point where joint replacement is unavoidable, and that is expensive. Osteoarthritis is the most common form of arthritis, involving chronic inflammation, breakdown, and structural alterations of the joint. In Chinese medicine, OA belongs to bone P. Combined pathogens of wind, cold, dampness will lead to qi and blood obstruction and ultimately lead to osteoarthritis. Okay, so we look at the three pathogenic factors. Wind, cold, and dampness, causing qi and blood obstruction. The kidney governs the bone and it produces the marrow, and osteoarthritis is closely related to kidney deficiency. Osteoarthritis often occurs at weight-bearing joints, and that those move the most. Now let's go to external causes. Wind, cold, dampness. Old or weak persons have a deficiency of wei yang, or what we call defensive yang. So if you have a very deficient defensive yang or wei yang, you are very, very vulnerable to attacks of wind, cold, dampness. And therefore, you will have obstruction in the channels, and there will be stasis and with pain. Okay. Another external cause would be local trauma. So as much as possible, especially when we're not that young anymore, we should avoid trauma. Okay. Trauma can actually bring about uh, an impedance in the local qi and blood circulation. So, of course, this will lead to qi and blood stasis accompanied by pain. Now, let's go to internal causes. Kidney yang deficiency in the elderly. This will lead to lack of nourishment to the bones and sinews. And therefore, this can bring about osteoarthritis. Okay, so we would suggest that you need to really, address this pattern as early as possible, because having kidney yang deficiency will actually lead to OA in the future. Another internal cause would be essence and blood deficiency. So try looking at your tongue, and you would notice that the tongue is quite thin and pale and dry, and you would see something at the posterior third of the tongue, okay, a V shape. When you have liver blood, kidney essence, and bone marrow being insufficient, the channels become empty and they're not able to nourish your sinews, muscle, bones, and joints, and therefore you will have osteoarthritis. Okay? Conventional medical treatment for hip joint pain typically involves surgical or drug treatment, and sometimes hip replacement surgery to alleviate the pain. However, traditional Chinese medicine can be used as an alternative treatment method to avoid the side effects of conventional drugs and surgical treatments. TCM treatment methods for hip pain include acupuncture. There is such thing called pharmacopuncture, herbal medicine, cupping, moxibustion, and the Korean-style manual therapy called Chuna. Acupuncture is effective for pain relief. The general mechanism of acupuncture treatment is to act on the central nervous system to stimulate the secretion of opioid peptides such as beta endorphin, enkephalin, and dynorphin, which produce analgesic effects. In addition, there are various types of acupuncture, including auricular acupuncture or ear acupuncture, electroacupuncture, pharmacopuncture, and acutomy. Among them, auricular acupuncture is very popular, which is known to relieve pain by stimulating the nerves of the auricle and correcting imbalances in the body in both directions. So these are, always start with the distal points. A very good practitioner will always start with needling the distal points. We have the following: GB41, GB40, bladder 62, and spleen 3. So let's get to know the points more. Okay, gallbladder 41 is the main distal point in hip joint pain. It is called the wood point, shoestring point of the gallbladder channel, and as such, being a shoestring point, it can expel pathogenic factors from the channel. So we're talking about, excuse me, expelling the wind, cold, damp from the channel. GB41 is the opening point of your daimai, and its connection with daimai makes it particularly useful when there is stuck B from damp in hip and knee. In most cases, when you have hip joint pain, you will also have knee pain. And GB41 is extremely important for promoting the smooth flow of liver qi. GB40. So I'd like you to focus on the ear point where gallbladder 40 is. So we have GB40 if you prefer body acupuncture, and GB40 on the ear. GB40 is a source point or yuan source point of the gallbladder channel, which is always involved in hip pain. locally used for weakness and swelling of the ankle and lower limb and for joint pain, for example, of the hips. Okay. And this is used to tonify and move the qi in the gallbladder when there is stagnation or deficiency. Gallbladder 40 regulates the gallbladder and promotes the smooth flow of liver qi. It clears liver, gallbladder heat and damp, dispels Shaoyang pathogens. Bladder 62. Okay, I'd like you to take note of the location of bladder 62 on the ear. This is called the opening point of the yang chao mai, or the yang stepping vessel, which also flows over the hip. Yang stepping vessel promotes agility and movement, and this point is especially useful if you have a very stiff hip. This is also called the calm sleep point, so you would be able to sleep well if you do needle bladder 62. It is also called the Sun Si Miao ghost point. Bladder 62 is used for mental level problems together with kidney 6, which is the opening point of the yin chao mai, no? Or the yin stepping vessel, especially for insomnia, mania, or extreme fear. Now let's go to spleen 3. This is a yuan source point, shoestring point, important point for tonifying the spleen. Spleen channel affects the inner aspect of the hip, and this is useful if the hip pain radiates to the groin. This is especially effective for people who just can't let go or can't move on with their lives, for people who are stuck mentally or have obsessions. Spleen 3, this is my favorite for people who would always complain of being sleepy after meals and those undergoing chemotherapy. Okay, so we're done with distal points. Now let's go to local points. You don't exactly have to needle all of this. You just have to choose like 3 or even 4, no? GB31, GB30, GB29, spleen 12, bladder 32, bladder 54, bladder 36. Now let's start with gallbladder 31. This is the point where the wind pathogens can invade the system. They're gathering like people at a market. This is my favorite point for people with skin disorders or in cases of severe itching. So we use it for hip and leg problems as a local point for weakness, numbness, or wasting of the legs. And GB31 is particularly good with moxa. The most important local point is gallbladder 30. So if you wish to do the body acupuncture, you need to be very precise with its location. And GB30 is considered to be an important point for hip disorders. Why? Because it can expel dampness and remove obstructions from the gallbladder channel. So if you do body acupuncture, it should be needled at least 2 inches deep, with the patient lying on the opposite side and the leg is slightly bent. And if you use a warming needle on GB30, this is very effective. And you could always see the smile on their faces if you needle GB30 because it helps a person's mobility. That means they can jump once again. Okay. And this one is sourced from the very famous Paul Nogier, the father of modern auricular therapy. As you can see, I'd like you to look at this very closely or take a screenshot. Okay, what do you see? So we have here the gluteus muscle, gluteus maximus muscle. Wait long, yeah. Okay, here is the hip joint zone. And this is the thigh point. And this is the knee joint point. Okay? Yon. And these are your toe, the toe zone. Okay? The fibula zone. Okay, I hope you'll find time to needle them. Okay? Okay, let's continue with gallbladder 29. This is the meeting point with yang chao mai. Very useful point for pain in the hip or from hip to groin. And GB29 is frequently tender on pressure and very effective when you combine this with gallbladder 30. So if you look at the ear, it's so easy to locate. It is simply located at the bifurcation of this one. Can you see that? Gallbladder 30. And this is useful where there is difficulty in straightening the leg. No? And if you do body acupuncture, you can do moxa. It eliminates wind and cold. Now let's go to spleen 12 here. Okay? This is used as a local point, especially when the hip pain extends to the groin. It regulates the chi, dispels dampened heat, and clears the channel. Bladder, okay, other points would include bladder 32. And this is my favorite for wasting conditions, those whose patients are so are losing a lot of weight, no? And it strengthens the kidneys, the lumbar area, and the knees, bladder 32. So if you're going to locate this here, so the bladder 32 must be located somewhere here, okay? Because they tonify the kidney, they also strengthen and invigorate the lumbar region and the knees when weakened through kidney deficiency. Like many of the sacral points, they can be used in wasting conditions. Then we go to bladder 54. So here. This is for sacral complaints that radiate to the buttocks and the legs. And if you palpate this area, this region, it's going to be tender. Okay, it's good with moxa. So on the ear, it's so easy to locate bladder 54, somewhere here. Okay, posterior ear. Next, we go to bladder 36. This point can be effective for sciatic pain. So those with sciatica, which follows the bladder meridian down the leg. So this is something that you wouldn't like to happen, right? So before it happens, you have to see a good acupuncturist. Okay. So in summary, these are the distal and local points for the hip. Okay. You can take a screenshot. So what are the foods fit to eat? Foods rich in vitamin B1. You can Google the sources. Foods that are considered to be bacteriostatic, like cinnamon, turmeric, no, moringa, yon, honey. Foods rich in protein. I think this is very common. And according to one expert, you might want to eat a lot of tomatoes, dry bean, and Chinese yam. What are the foods unfit to eat? Foods that irritate. Now, this is like example, tomato sauce and citrus fruits, okay? Or even carbonated beverages, diba? Avoid oily foods, avoid high cholesterol foods. So if you can help it, avoid pepper, avoid strong tea, and lard oil. Now, the big question is, can acupuncture help? Acupuncture proves to be highly beneficial in reducing inflammation of soft tissue and cartilage, which may be common causes of hip pain and long-term discomfort. Studies into the effectiveness of acupuncture concerning osteoarthritis and chronic conditions are ongoing, but needling remains highly popular for immediate pain relief and gradual restoration of mobility. Whether or not acupuncture for hip pain is effective at stopping pain relies largely upon the patients in question and the severity of problems they may experience. For example, athletes, no, because of wear and tear, no, they may benefit from regular acupuncture treatment to help relieve inflammation in their hips, to better prepare their bodies for further exercise. Okay. Hip acupuncture has a firm place in some sports therapy disciplines for this reason alone. So can you just imagine if you can needle the ear instead, no? Acupuncture for the hips can help foster more efficient long-term tissue healing, for example, by promoting collagen dispersal. Over an extended period, you may find that acupuncture can help relieve common hip pain and restore flexibility and stability to your joints. In any case, it is essential to discuss your case with a qualified, experienced professional. It is important to seek acupuncture for hip pain as soon as possible, as soon as discomfort distracts you from everyday life. While occasional aches and pains are to be expected, chronic hip discomfort can build slowly over time. And you will be developing shooting pains across the buttocks and down to your legs and feet. It is prudent to seek pain relief and mobility restoration ASAP. If you are already diagnosed with a chronic hip condition, it is recommended to speak with a physician about available therapies. Often, a doctor will refer you for acupuncture or other targeted therapies if they feel the practice will offer pain relief and increase flexibility. In any circumstance, why not reach out to a doctor and or acupuncturist for advice? Diba? Okay, if this is your first time to seek acupuncture treatment, the practitioner, the clinician will discuss your pain and flexibility concerns in detail. You may be asked to show your full range of mobility with your hips and to complete a strength assessment. This is to ascertain the full extent of pain and or joint inflexibility. An acupuncturist will then take the time to explain how the procedure works in detail. Acupuncture and other types of needling are not painful. The most you may feel in your hips or elsewhere is a slight pressure and a warming sensation. Your acupuncturist will typically aim to release the knots and tight tissue and redirect oxygen and blood to flow to your hips and legs, depending on your pain level and or discomfort level. Your specialist may recommend needling distal points across your body that aren't necessarily connected to your hips or legs. So we have discussed this earlier. These techniques can help to promote long-term healing and revolve around your specific needs and profile. And acupuncturists work on complex maps from which they can decide how to direct oxygen and blood flow to points in your hips needing relief and restoration. You'll commonly find that even if only one hip may be hurting, specialists will set up symmetrical needles around your body. Okay, so even, of course, most of your patients would only complain of unilateral hip pain. However, we would do both sides, no? And this follows the ancient practice in which many techniques are still rooted today. Following your first acupuncture session, you can expect a more than 50% improvement in mobility in hips and associated joints. Beyond this session, it is important to continue attending your scheduled visits to help reduce additional inflammation in your hips, legs, and buttocks. This is especially important too for sports people and those who are highly active. A staving of inflammation can help you retain an increased range of mobility and reduce the chances of experiencing further pain. While all bodies are slightly different, acupuncture is helping millions of people regain flexibility and mobility in everyday life. We rely on our hips more than we may imagine from day to day, which is why it's crucial. It is very, very crucial to pay attention to any pain or discomfort you may find starting to impede your work and leisure. You should never let hip pain hold you back from a rich, full life. What's more, treating chronic pain early may help you to stay flexible and mobile for years to come. Seeking direct pain relief and mobility restoration from an acupuncturist and or physician may be what your body's crying out for. And thank you very much for your attention.
Thank you, Dr. Hector, for the great presentation. Actually, we have experience of hip pain at some point or the other, especially among males when they put their wallet at the back pocket.
Mm.
And that's one of the things that, having worked with people in physical rehab, they usually advise not to put your wallet, especially if you are more on the sitting position, or calls for a job that keeps you on the chair, because it actually involves your sciatic nerve. So thank you for that presentation. And it's true. I've experienced among a family member that actually has hip pain, and those points work, especially when you connect them to electroacupuncture, knowing that the patient is has chronic hip pain. So thank you, Dr. Hector.
Thank you. Any questions? Do we have questions?
I do not see any questions on the chat box. So if anyone would like to share an experience or actually have a question, you can please unmute yourself.
Thank you for the references. Yeah, for the facts that you presented earlier. Thank you.
You're welcome.
Okay. Would you like to ask a question, Dr. Tayo naman.
Actually, I just would like to share an experience that both the effect of auricular acupuncture and your body acupuncture, is pretty much comparable. And the reason why I say that is that I've tried it on my mom. Although my mom is a little bit has an aberrance to needles when it comes to the ear, so we
Mhm.
tried body acupuncture on her. I'm a very pro press needles,
Yes.
so I left press needles on her ear for
Mhm.
continued therapy. But so again, having presented both modalities in treating both
Mhm.
auricular therapy and body acupuncture, uh, also we have to consider the length of time or the chronicity of the problem. If it's
True.
something that's acute, then
Mhm.
it will take a shorter time to treat. But if the condition is chronic due to old age, or also due to chronic conditions such as osteoarthritis, or you have spondylosis, or
Yes.
what do you call this? Sciatic nerve problems. Those happen over time. So it
Yeah.
will take more than just one session, probably six or more, to actually address the pain. But I can assure you there will be an improvement because I've
Mhm.
experienced this personally.
Yes. Thank you. And let me add to that, Dr. Ryan. It all depends on how long you have had the hip pain. That's why I we were emphasizing earlier that as soon as discomfort sets in, you need to really um, consult. You need to really go or probably learn acupuncture yourself. No, let's not wait for the time when it nothing can be done anymore. Can you imagine someone who's been uh, having the hip joint pain for like 10 years, 20 years? Acupuncture can no longer help. But again, when I say help, that means the pain will not recur. Okay. So you may look at this as a lifetime thing, especially if you know how to do this at home. Got it. So when you say chronic, that means it's been with you for like 6 months, more than 6 months, or a year. Okay. So the earlier you consult, or the if you s- and if especially if you know a little about tongue diagnosis, you would look under the tongue. Remember, we had as part of our lamp lecture series, we discussed this. I don't know if a lot of you paid so much attention to it, but I always believe that looking under the tongue, or even the tongue itself, will really help a lot in determining whether or not you will have issues later on. And even if the symptoms, or even if apparently the symptoms disappeared, you may still want to monitor your tongue because, of course, we do not want to be stressed by having the same problems over and over again. Okay. So we have here a question from Dr. Christita Tiubali. She wanted to ask if ear acupuncture can be a standalone treatment for managing hip pain. This is a very good one. To be honest, Doctora, in fact, I am now, how would I say it? I am more into something that can be done by anyone. Okay. So sadly, I cannot give you facts about how this can be a standalone treatment, but I feel we can always start somewhere. And besides, if you are familiar with ear acupuncture, um, it works faster than body acupuncture. The only downside of ear acupuncture is that it um, you have to deal with you have to be very patient in locating the points. That's why we advise everyone to have the angled ear probe. Okay, and I think most of you own it already. In case you have, we're not selling it. You just have to ask Dr. Ryan where he got his. Dr. Ryan used to be a patient. Now he has all the gadgets that he needs. Okay, so I believe that this can help, no? And I've done this on one patient, and she was surprised why um, the hip pain improved or lessened. Oh yeah, that's the straight one. Well, don't you have ano pala siya? Naka-bend pala. Okay? And mind you, for those who are still doing body acupuncture, you can use the other end. In fact, it was Dr. Ryan who discovered it. I don't know if it's true, but I guess so. We would actually um, probe the point to find out if that point has to be needled. As a matter of fact, the probing actually is more painful than than the needle itself. Diba? So, ganun kagaling si Dr. Ryan. So, it's so difficult. And of course, you have to wear glasses and make sure that you have to, you know, not let the hair get in the way. So, if you have long hair, you probably would want to use a hair clip or something. Yon. So, I hope you can try doing that, uh, Dr. Tu Bali. Um, of course, this will not go away in just one session. This has to be done. Um, if it's a chronic one, you may want to do it every week or twice a week. So it's best that you own a probe. Okay. I'm actually working. I don't know if I asked the co- the comment of Dr. Ryan, will ear acupressure really help using the ear probe? I think so, no? What do you
It
think?
does.
Yes. Mhm. So,
It does. It
yeah,
just has to be precise.
yes. I hope that answered your question, Dr. Tubali. Okay.
Yes, sir.
I really
Uh,
think
we
it can stand alone. Yeah.
we have a question from Miss Paula Betita. I know someone who has 35 years of chronic hip pain. How long does that normally take to at least significantly reduce pain
Okay.
to make it more tolerable? How many sessions?
Oh, that's a very difficult one. What is important here is, okay, every time I see a new patient, I would ask, especially if the patient is is in pain. And having had the pain for 35 years, that means you um you've been living with it for quite some time. So that's something that may not actually matter so much. But again, reducing the pain by 50% on your first session is unforgettable. So with regards to the number of sessions, okay, the the number of visits would be less frequent. The spacing would be like longer. I would usually for someone who's 30, okay, first I need to insist that the patient should learn how to take care of himself. Okay, you have to teach what to eat, what not to eat, or probably you can assign cheat days. So every week or every 2 weeks, for about, well, more or less 1 year. That's why I would advise you to really to learn how to do ear acupuncture. This is something that we can teach anyone. Okay. Thank you. Would you like to talk, Ma'am Paula? Betita Tan.
No, I just want to say thank you. Yeah, I'm actually with someone right now who also has uh
Oh,
yeah, chronic hip pain. So I just want to ask because uh I actually let them listen in also on the webinar. And yeah, I have someone who had no idea had 35 years of chronic hip pain. And apparently this webinar was very beneficial for him
Thank
as well.
you. Don't let
So
him,
thank you.
don't let that somebody see me. I will give you a task. Okay.
Okay.
Um, with yeah, we've been seeing each other for 2 sessions yet, and I hope. Okay, you don't have to tell them what you came to see me for, but
Okay.
I was more interested in really teaching you how to do ear acupuncture.
Mm-mm.
Okay, Ma'am Paula, please meet Dr. Ryan. Uh,
Hi.
you
Hi,
might
hello.
like each other because you are both gourmet cooks or whatever. Yun.
Yes.
So, okay, you start with the ear. Um, I can lend you my other probes if you don't have it yet. And yeah, let's meet. Di ba I showed you kanina, I have one with me, which I
Mhm.
carry with me all the time. And I have one or two in where I do acupuncture.
Yes.
It seems that you look very happy. I hope, you know, I I think it won't hurt if I tell them that you are a yoga practitioner.
Yes. Yeah. I'm a yoga well, I'm a yoga instructor on sabbatical. Is that right?
Yes. Um,
Been a
Mom,
year, more than a year since I
yeah,
took up with
before
it.
I forget, I'd like you to meet Mom Marsha, who's in Australia right now. She's an expert on yoga. Mom Marsha, please meet Mom
Hi.
Paula. Oh, di ba? Yogang-yoga na siya.
Hello there. I'm also I'm also a yoga instructor on sabbatical. I
Yeah, me
I
too.
I focus on teaching qigong these days because it's more in line with my ear acupuncture studies from Dr. Hector.
Okay. Okay.
Okay, I feel guilty when you told me that it will take time for you to be able to absorb all the info. So as a gift, Mom Marsha, so that I won't feel guilty anymore, I would like to email to all of you the notes. Okay, would that be okay? I think,
That would be great. Thank you.
yeah,
I
so
usually yeah.
I'll make an outline. I think what would interest you a lot would be the points.
Yes. Yes,
And
because
the book. Yeah,
sometimes when I look at your side by side photos for the body points and then the ear points, I sort of can't really see which
you
ones of those
can.
blue dots
No.
is the one I'm after.
You have
So
the ear probe, Ma'am Marsha, right? You brought it with
I
you.
do. Yep. Yep.
Great.
Yes.
So is it sinking in now?
It is.
So you are both on sabbatical. So let's get you out of your sabbatical. Thank you.
Thank you.
So, and also thank you. Would it be okay we do knee pain next time? So these are the things that although I would want to discuss anxiety, kaya lang parang it's so easy to treat anxiety these days. Do you agree, Dr. Ryan?
With the heat, it will probably worsen the anxiety.
Yes.
One thing I'd like to add also is that it's also important that a balanced diet would be,
Precisely.
TCM encompasses
Yeah.
not only acupuncture but also on the foods that you want to eat. And the great, what it calls a great time about living in today is that we can Google everything. Correct.
Yeah.
So, there's a lot of very
Yeah.
good sources that you can find on what foods to eat, especially when it comes to pain, because
Mhm.
pain definitely is a reflection of an imbalance that causes the
Yeah.
pain, which is brought about by an organ that's being affected. So if we treat not only the pain but also treat the organ that causes the imbalance, then it's a much more holistic approach. Also, I'm not trying, acupuncture. I strongly believe acupuncture could be a standalone, but it also is a very good complementary way of Western medicine, because in itself, hip pain could be caused by a fracture, but we need to find out what
Yeah.
is the cause of the hip pain, in
Mm.
that we can properly complement with
Precisely. Yeah.
acupuncture. Acupuncture decreases the use of medication. It also increases the healing time because of being able to balance the energy that you have. And
Yeah.
also, third, it makes the patient feel a little better because of the shortened time it is to address the hip pain on top
True.
of the medical management that they have.
Yeah.
So you know, I strongly believe in both, but I've also experienced that
Yeah.
acupuncture really did treat most of my pains
Mm.
overnight. So, you know, least to say, it is the best of both worlds.
If you will have a patient like Dr. Ryan, my God, you have to be really on your toes all the time because he would double check the info. So yun. And now,
I would like to share, anyone that looked into the chat,
yes.
Victor Ginto has shared that the benefits of using GB30
Mm.
and 31 bilaterally from the video, he has used this also on stroke in the video from
Um,
Acupuncture Matters. And then Ma'am Jennifer Duran commented, very thankful for this very informative knowledge, beautiful practice, helpful practice from our for our veterans, seniors in this field. She's very grateful.
Thank you, Mom Jennifer. Anyway, let's go back to for the information of everyone. Sir Victor Ginto, if I'm not mistaken, he donated his cane, his walking, ano ba tawag doon? Yeah, to Lump office because he can now walk. May we request Sir Victor to tell us more about it? And all he did was to watch the video on, so subscribe na kayo, Acupuncture Matters. Sir Victor, are you okay?
Yes, Doc.
Wow.
Uh, I had my stroke last July last year,
Okay.
and I was able to walk mid-August,
Same
actually,
year. Same year.
same year.
Okay, you're lucky. Yes. Yeah.
Because I had acupuncture, and then I had 3 sessions from a local acupuncturist here,
Mm,
and then I bought a book on Geo scalp and
yes.
had my and I had my wife do it to me
Mm,
because I was really looking for somebody who can do this
mm.
scalp to me, but I couldn't drive anymore. So one of the methods was from your videos. It was really very helpful because
Thank you.
yeah.
Yeah.
So one of them was I remember it's GB30 and 31.
Mm.
I don't know what number of stroke video was that, but
There are a lot.
yeah, I think 8 or maybe more.
Yes.
Thank you very much.
Thank you, Sir Victor. And you know what? Sir Victor is lucky. Talking about stroke, acupuncture can be very, very helpful 100% as long as you have had the stroke for only 6 months or less. So the shorter the st- the time frame, the better. So for those who had the stroke for like a year, of course you had to combine it with prayers and you need to do the scalp. Yon. Um, Talking about scalp acupuncture, we have all 10 modalities on the video and we have books on it. Okay. Thank you.
Doc, let me add. My hip pain on the left side, it was I think uh, until 4 to 5 months.
Yes.
But since the GB30 and 31, it was much reduced until it was gone.
Yeah, it's true. Diba? GB 3031. That info came from Giovanni Machocha, the legendary uh, author of the Bible in acupuncture. Thank you for believing in acupuncture, Sir Victor. It's good to see you without the cane anymore.
Thank you very much.
Okay, thank you. So let's not wait for the time when we are immobile already, when we can no longer make use of our joints. Okay, I'd like to make this like you know a preventative thing. So you have to all look at your tongue and do not ignore any minor discomfort that you experience because who knows it can lead to something more profound. And these days, when you get sick, it's going to cost you a lot. Even if you have the money, taking care of somebody in the hospital is putting a lot of stress on the one who, on the caregiver. Okay, I had I think 3 patients. Their caregivers, who happened to be their relatives, died ahead of them. Can you imagine taking care of someone like 24 hours a day? You have to do ba? Okay, so try to be more responsible. Learn or teach your companion, your partner, on how to do ear. So let's try to teach everyone how to do ear acupuncture. You have, you can, andito pa si ano? Okay, we would like to invite everyone on Monday if you happen to be in Manila. Okay, by the way, Sir Albert is busy because he's part of the group that does wellness missions along the Sampaloc area. So they usually give weekly sessions on auriculotherapy. And I was thinking, because we wanted to know hip, if ear acupuncture can be a standalone treatment for hip pain. So we would like to offer this for free in Extremadura, no? So sino ba dito? Okay, Ma'am Lynn. O si Ma'am Lynn andito ah. Ma'am Lynn, good afternoon. How was your wellness mission earlier? Ma'am Lynn, are you there? Yeah, we'd also would like to welcome Dr. Gavino, iPhone 12 Pro. Siguro in the future, iPhone 16 na to. Dr. Gavino, good afternoon po. Ay, nandyan na. The legendary expert on scalp. Ay, nako, hindi kalimutan ko.
Magandang hapon po.
Yes, good afternoon po. Thank you for coming. It's an honor. Dr. Gavino is one of the most approachable MDs who is actually a certified medical acupuncturist, who seems to be so indefatigable when it comes to learning new things. And if you happen to be be in Manila, please try to attend his lectures on scalp. Anyway, we will be announcing it on our group chats. Okay, salamat po, Dr. Gavino. Okay. Wala na? Tapos na. Would you, okay. So we're done. Thank you so much.
So I'd like to thank everyone for attending, and always try to be safe, stay cool from the heat, because heat could be a source of pain.
Yes.
Yeah.
Yeah, we also have, thank you. We have here a message from Mom Jennifer Duran. I have a strong desire then to have ear acupuncture clinic here in Masbate. It is, you know what I like about ear acupuncture? First, it's not regulated yet, no? In fact, when our marketing director, Sir Albert, had the chance to talk to the Director General of PITAC, she even asked, she did not expect ear acupuncture to be so that it can do a lot of things, no? Of course, for other like stroke, I don't think it can be a standalone treatment, no? But again, if we study the ear, we expect you to be also good at diagnostics. We would like you to, in fact, enroll in basic acupuncture training, because it always helps, no? If you know the basics, so that it will be faster, okay? So, but if you're not certified yet, nobody will run after you if you practice ear acupuncture. Good luck, Ma'am Jennifer. Please get in touch with Sir Albert Machete, no? Or you can email Lam. Good luck, and I know it will happen. We can help more and more people. Okay, so with that, basic tongue and pulse diagnosis. It really helps talaga. And what I do with my patients, of course, if you see my my album sa cellphone, you will see only tongues and ears. And this is my way of really bonding with my patients, because of course you have to ask for their FB. So if they're happy, they would be willing to share with you uh, their FB. No, you will be friends on FB, and every time they come, we would take pictures of the tongue, and we let them. We also teach them the pulse, the the easy way. Okay, this is quite important. Thank you. Excellent naman. Grabe, nakakataba ng puso. This is actually not a complete training. This is quick, comprehensive approach, especially during these times. Okay, so let's come to a vote. What topic are we supposed to have next? Kasi I've seen a lot of, parang iba-iba ha. Meron nagsabi neck pain,
Neck
headache.
pain.
Ano ba yan? Let's decide. Neck pain, neck pain, or ano? Sabi ni Ma'am Marcia, knee pain.
Any kind of pain.
Okay, let's have knee pain, because Ma'am Marcia was the first to ano. Oh, then after knee pain, we have neck
Neck pain.
pain, puro
Yeah.
pain. Oh, chest, headache, chest pain. Sige, well, can you take it down, Dr. Ryan? So first,
Yes.
knee pain,
Neck
neck
pain,
pain.
chest pain, and then headache.
Yeah. Okay, this is not a parang ano ha, how do you call it? Just relieving the pain is not enough. You
Yes.
need to know what's causing the pain. And this is where we can tell if you're really good. You need to tell us what's causing the pain. Okay? Stroke patient, God, stroke. Yeah. Actually, ganito na lang. For stroke, mas maganda yung prevention. GB39 and stomach 36. You moxa that twice a week. Okay? Use the Google. Gallbladder 39, bilateral, and stomach 36. Yung mga hindi pa na-stroke ha, because take note, it can happen to us anytime, especially ngayon. No? Or attend the very comprehensive training, face-to-face po yon, scalp acupuncture. There are actually four lecturers. Okay? Dr. Webb, Lim, Dr. Gavino, and Dr. Panotes. Okay, we'll keep you posted po. So, wala na? I think we're good. Good luck, Ma'am Jennifer. Yeah, thank you, Sir Arkin. Thank you po.
Okay. Thank you, everyone, and have a great weekend.
See you soon. See you next week. Thank you
Thank
for your time. Bye-bye. Good night.
Doc Hector. Thank you, Doc Ryan.
Thank you.
Thank you po.
Thank you. Bye-bye.
Thank you.
I'll end it na. Bye-bye.